Hey, young man. If your body is quiet, it might be whispering what you don't want to hear. 90% of the HIV cases I diagnose walk into my urology office first. I'm Dr. Jame, a urologist and HIV researcher with 20-plus years caring for men. America 2025. CDC's latest update reports 39,000 plus new HIV diagnoses in 2023. Over 80% were men, and 66% were attributed to male-to-male sexual contact. Add heterosexual transmission and sexual contact involving the penis accounts for roughly 9 in 10 male cases. The penis is the front door far more often than people realize. Let me flip a belief you may hold. Many HIV cases don't begin with fever or cough. They begin with ordinary urological symptoms: pelvic discomfort, cloudy urine, a performance dip, the kind you'd blame on stress or age. Stay with me. In minutes, you'll learn 6 hidden signs men miss, plus a 3-step check you can run at home to protect yourself early and confidently. Watch signs 4 and 5. They shock men because they feel so familiar. At the end, I'll share one practical, science-backed penis protection habit that boosts desire and helps married life feel charged. Comment number 9 if you believe awareness comes before protection. Subscribe. One click seems small, but it helps me reach 1,000 and bring you more clinic cases. Before the signs, I'll show why early detection is the line between freedom and regret. I know it's easy to blame everything on stress or getting older, but no, what you're feeling is a lost connection between your body and your attention. Last month, a 25-year-old man named David sat across from me, breathing hard, eyes tight. "Doctor, please check me and guide me," he said. "I've lost sleep for a week over this." Here's why men miss early HIV cues. The signals mimic everyday urology issues: faint skin irritation, a slight odor, a sting after intimacy, frequent dribbles or cloudy urine that comes and goes. Like a flickering wire behind a wall, the circuit isn't blown, it's unstable, and you only notice it when the lights dim. Most early cases show up first through the urological or genital skin system. They get treated piecemeal, creams here, antibiotics there, and testing is delayed. That delay is the exact window the virus uses to entrench itself while life looks normal. Early detection changes everything. Start treatment sooner and you reach UU. Undetectable equals untransmittable. Faster, protecting your partner and your own sense of honor as a man. You carry less psychological weight, return to work sooner, and stop waking at 3 a.m., wondering what you're missing. Listen. You are not weak for getting tested. You are strong because you choose to look straight at the truth before it chooses you. Do you hear yourself in any part of David's story? If you do, tell me in the comments which part rings true. Before we move to the dangerous symptoms, give me 90 seconds to remind you of something no man should lose sight of. Another reason men delay is pride dressed up as logic. You tell yourself it's the new soap, a tough week at work, dehydration, or too much cycling. Friends say, give it time. Clinics say, let's try another cream. Meanwhile, the pattern repeats, and patterns are never random. When the same minor issues cycle every few weeks, your body isn't nagging. It's negotiating for your attention. Answer it now, and you trade months of fear for a single, decisive plan. Next, I'll show you 3 things to remember before testing, so you don't wander into the diagnostic blind spot. Part 3. Grab a pen and write this down. One wrong step before testing can set you back an entire month. I'm talking to you directly, man to man. This section matters because it shapes your future. When you finally look for the cause but make the wrong move, the fallout can be worse than the fear itself. So, before you test, avoid 5 traps: waiting, self-medicating, hiding the truth, choosing the wrong test, and skipping follow-ups. David, the 25-year-old I mentioned, helped me connect the dots across many similar cases. Listening to his story confirmed the same pattern again and again. 5 predictable mistakes that turn weeks into months. First, pick the right test, not just the fast one. Ask for a 4th-generation antigen-Haas antibody test for standard screening during the window period. If your risk was very recent or high, add an HIV RNA test. Think of it as using both a floodlight and a flashlight. Wide coverage plus early detection. If your clinic doesn't offer RNA, ask where you can get it. Second, follow the timeline that keeps you honest. Use the 60 to 60 to 3 plan. Round day 60, or 6 to 8 weeks after exposure, get your first 4th-generation test. If you can test earlier, repeat at week 6. At 3 months, confirm your status. Set reminders on your phone the day you schedule, and keep every appointment. Third, be transparent. Tell your clinician the real details of exposure and the exact symptoms, even the ones that feel awkward to say out loud. You are not there to impress anyone. You are there to protect your life. I am here to protect you, not judge you. Fourth, do not self-treat. Antibiotics, creams, supplements, or internet fixes can blur the clinical picture and delay proper testing. Fifth, never disappear after a reassuring moment. Temporary relief can trick you into silence. Follow up, even when you start to feel better. If you've stumbled into one or more of these traps, you're normal. Most men do, until experience teaches them otherwise. Remember, education only, not a substitute for in-person medical care. Are you ready? Next comes the 6 hidden signs many men mistake for simple irritation. Short CTA. Comment "I'll test" if you're committed to testing correctly and early. I strongly encourage it. No more waiting. It's time to reveal the 6 headliners you need to know. We'll go deep on each sign so you never overlook yourself again. One more thing. Anxiety and stigma are loud liars. They tell you to delay, to downplay, to disappear. Don't listen. Your visit is confidential. Questions are welcome. Paying attention today costs far less than repairing damage tomorrow. Courage first, clarity next. Calm follows. That is how grown men take back control. Grab a pen and a sheet. Your notes decide whether you identify this correctly. Back to David. When I explained this first sign, he went quiet. The look of someone realizing the pattern had been there all along. Name it clearly. Treatment-resistant chronic prostatitis. What it feels like. Dull, dragging ache in pelvis or perineum that flares after intimacy. A faint burn at the tip. Heaviness while sitting or driving. Symptoms that lift for a few days, then creep back. You've tried antibiotics or anti-inflammatories, maybe 2 rounds, and it still returns. How it fools you. On ordinary days, the pain is a whisper, easy to blame on cycling, office chairs, or bad posture. Tests look normal. Cultures are negative. Friends suggest another cream. Each small improvement convinces you to wait, and waiting is the trap. Biology in one line. This is not just inflammation. In early HIV, immune signaling can stay switched on, sensitizing pelvic nerves, disrupting local barriers, and creating a cycle of flare and false calm. What to do now? Start a symptom log. Pain score, intimacy, workouts, urination changes, sleep. If symptoms persist beyond 4 to 6 weeks despite treatment, request a 4th-generation AG/AB test. If risk is recent, add an RNA test. Stop self-medicating. Follow up on schedule. Say this aloud. Patterns aren't random. I will check. That decision can end months of guessing. Next sign. When performance dips under 40 with perfect circulation, listen closer. Quick question for every man under 40. Have you noticed a slide in firmness or staying power? If yes, take this seriously and listen through. We call this pattern erectile dysfunction under 40 with normal circulation. It looks like a performance dip that arrives fast, hangs around, and resists quick fixes. You feel more tired than usual, morning erections fade, and your recent labs show a downward drift in testosterone. Here is the key distinction. Your cardiovascular tests look fine: Doppler, lipids, blood pressure, yet performance keeps slipping. That mismatch points away from plumbing and toward hormones and immune signaling. Early HIV-related inflammation can disturb the hypothalamic pituitary gonadal axis, lower free testosterone, and blunt sexual confidence long before routine labs look dramatic. What to do now? Schedule a 4th-generation HIV AGI-AB test. If the exposure was recent or high risk, add an RNA test. Order a morning hormone panel: total and free testosterone, SHBG, LH, FSH, prolactin, and TSH, and repeat abnormal results to confirm. Do not self-medicate with random pills. If a PDE5 inhibitor is prescribed, keep testing and root cause workup going. Pills are not a diagnosis. Tighten your daily inputs. Sleep 7 to 8 hours, cut alcohol and nicotine, limit porn and scrolling, reduce saddle pressure if you cycle, practice pelvic floor relaxation. If you do not have this problem, great. Comment "continue" so we keep moving forward together. Next sign: when urinary tests say negative, but the burn returns. Watch closely today. This one matters. It's easy to dismiss and quick to repeat. You feel a sting when you pee, urine looks cloudy, maybe a faint odor. You test, cultures are negative, things calm down for a week, then flare again. That rhythm is the tell. 1 to 2 weeks quiet, then back, with no bacteria on the report. Underneath, this can signal immune imbalance along the urethra, irritation without a classic infection. Early HIV can nudge that imbalance, thinning local defenses and keeping nerves on alert. Symptoms often cluster after intimacy, long sitting, or dehydration. There is no fever, no flank pain, and antibiotics help briefly, if at all. Topical creams blur the picture, and the cycle returns when you stop. What to do now? Hydrate and pause irritants for 48 hours. Alcohol, spicy foods, harsh soaps. Ask for a 4th-generation HIV AGI-AB test. If exposure was recent or high risk, add an RNA test. Request urinalysis, an STI panel, and consider a prostate exam if pelvic ache joins the story. Stop chasing internet cures. Follow the plan and book a follow-up to review results. How do you feel hearing this? If you're ready to keep momentum, comment "Let's go," so we reset our energy and push forward together right now. Next sign: when a groin lump lingers 4 weeks without pain, treat it like an alarm, not a mystery. For this sign, slow down and use your hands. Gently feel along the crease where your thigh meets your pelvis. Do you notice a small, firm, mobile lump that doesn't hurt, isn't red or warm, and refuses to disappear after 4 weeks? That is the classic description. Size may shift a little day to day, yet the node remains, like a pebble in a pocket you keep rediscovering. Many men worry hard when they find it, and some clinics even suggest procedures that aren't necessary. Plain meaning, your immune system is working overtime. In early HIV, groin nodes can stay activated, filtering and signaling without the dramatic fever or illness you expect. It isn't proof of HIV by itself, but it is an alarm you shouldn't snooze. What to do now? Don't squeeze, poke, or test it all day. Manipulation keeps it enlarged. Book an exam with a clinician. Ask for a 4th-generation HIV AGI-AB test, plus an RNA test if exposure was recent. Track size weekly in a notes app, compared to a pea, bean, or grape for consistency. Skip internet rabbit holes. Wait for professional assessment and labs. If you don't have this sign, I'm glad for you. If you do, your concern is appropriate. And getting seen quickly is exactly the mindset I respect in grown men. You're choosing clarity over guesswork. Next sign. When night sweats join urinary changes, treat the combo as a system-wide message, not a coincidence. This minute matters. If you're still with me, stay focused for 60 seconds. When night sweats show up together with urinary changes, treat it as a red light moment, not random bad luck. Here's what it looks like. You wake drenched 1 night a week, sheets damp or soaked, without a fever or flu. At the same time, you notice urges to pee, a cloudy stream, a faint burn, or a dull ache low in groin that comes and goes. Alone, either symptom can be explained away. Together, they suggest a system-wide process. Your immune network is switched on, and the urological system is feeling it. Early HIV can produce this paired pattern weeks before routine labs look dramatic. What to do now? Book labs. A 4th-generation HIV-AG/AB test. If exposure was recent or high risk, add an RNA test. Ask for an immune panel and urinalysis with STI screening. Stabilize your inputs for the next 72 hours. Hydrate, sleep 7 to 8 hours, avoid alcohol, spice, and harsh soaps. Ease off cycling or long sitting. Log the pattern. Time of sweat episodes, fluid intake, urination frequency, odor or color changes, and any pelvic ache. Patterns guide decisions and shorten delays. If this is not you, good, keep listening for the next sign. If it is you, move first, think later. Clarity beats worry every time. Next sign. Muscle loss or unexplained weight drop can be the clue most men notice last, and it matters more than you think. Over the last 1 to 3 months, have you noticed your arms or thighs shrinking, or the scale slipping despite eating and training the same? This is the sign most men misread because it can imitate dieting, stress, or a gym break. Observation checklist. Upper arms and quads look flatter, pants loosen at the waist and thigh, veins more visible, and weight drops more than 5% in 3 months without trying. If you paused workouts briefly and still keep losing shape, pay attention. Biology in plain English. Systemic inflammation and metabolic disturbance can accelerate protein breakdown and blunt muscle repair. Early HIV can tip this balance, raising energy burn while lowering anabolic signals, so you lose lean mass before blood tests look dramatic. What to do now? Request a 4th-generation HIV-AG/AB test. Add an RNA test if the risk was recent. Ask for nutrition and hormone evaluation, total and free testosterone, SHBG, LH, FSH, TSH, vitamin D, B12, ferritin, and review sleep quantity and quality. Keep protein near 1 gram per pound goal body weight, hydrate, and resume a light resistance training while you wait for results. It is a systems clue your body is spending reserves to fight a problem you have not named yet. Name it early, and you keep strength, confidence, and time. If you've noticed at least one of the 6 signs, don't go quiet. Next, I'll show you exactly how to test right and fix fast. Comment 1-6 with A, and I'll go deeper on your specific sign. Bridge, Part 5, a simple action framework next. Awareness isn't fear, it's freedom. You take control the moment you choose to see sooner. Back to David. He stopped guessing, followed a simple framework, and everything changed. Here's the core message I want you to carry into tonight. You are not late, and your body is still on your side. 3 steps: see, sense, scan. See, keep a 7-14-day log of sleep, skin changes, urination, energy, erections, and workouts. Sense. When your body whispers something is off, do not argue. Name the feeling, write it down, and use it to request deeper testing. Scan. Schedule a 4th-generation HIV-AG/AB test. If the exposure was recent or high risk, add an RNA test. Follow the 60-6-3 timing, about day 60, then week 6 if early testing, and confirm again at 3 months. Sleep 7 to 8 hours, Hydrate, prioritize protein, and move 20 to 30 minutes daily. Limit alcohol, nicotine, porn, late screens, and prolonged saddle pressure if you cycle. Medical education only. Science you can trust. Early treatment drives viral load to undetectable, and undetectable means untransmittable. Protecting your partner and your pride. My promise. Follow these 3 steps for 14 days and you will know exactly where you stand. No more guessing, just clarity and a plan. Now, the small secret I promised for protecting the penis and boosting desire. Adopt a 3-minute warm water rinse after intimacy and workouts, then pat dry and apply a pea-size unscented moisturizer to the shaft and foreskin or glands. This preserves the skin barrier, reduces micro-tears, lowers irritation, and sends a clear signal of readiness to your own nervous system. Start tonight. Comment number 7 and share so another man doesn't get lost. Part 6. Now you decide. I am with you as your physician and researcher. Everything I've said here is for one purpose: to keep you safe. Here is what to remember. 6 signs most men overlook. Chronic prostatitis that does not respond to treatment. Erectile dysfunction under 40 with normal vascular studies. The phantom UTI, with burning or cloudy urine but negative cultures. A painless mobile groin node that lingers beyond 4 weeks. Night sweats paired with urinary changes. Unexplained muscle loss or weight drop over 1 to 3 months. Hold the action frame that turns worry into clarity. See, sense, scan. C. Track sleep, skin, urination, energy, and performance for 7 to 14 days. Sense. When your body whispers, believe it. Write it down. Ask for deeper testing. Scan. Order a 4th-generation AGAB test. Add RNA if the risk was recent, and follow the 60 to 6 to 3 timeline. Why this matters. Early treatment drives viral load to undetectable, and undetectable means untransmittable. That destination is you. Protection for you and the person you love. You do not lose by getting tested. You win because you choose to know early, act early, and live early. If this gave you direction, drop number 9 as your promise to move forward. Subscribe to stay with me and share this with one man who needs courage tonight. Listen to your body. Test early. Protect your future. Your health is the greatest honor of my profession. No shame, no stigma, no speeches, just science, compassion, and a plan you can follow. Set a reminder now for your test window. Book the appointment before you close this video. Tell a trusted friend or partner so you have support. Take a breath. You are not alone, and you are not behind. Start tonight, please.